As Chaplain Rocky Walker walks the halls of the COVID unit at Manhattan's Mount Sinai Hospital, the Desert Storm veteran says he's never experienced death like this.
This is a nurse who's been with us for 21 years, and what do you say to that? I didn't have any words for that. I was fighting back my own tears.
Like every healthcare chaplain in the country, Walker's job has changed dramatically. He's often physically separated from patients and their loved ones, and that means connecting in new ways. Chaplain Kathy Disher at the James Cancer Hospital in Ohio checks in by phone with families these days and says they welcome her call.
Families are actually often looking forward for some conversation, to let them say what they would like to say, to maybe be more engaged in conversation, someone just to chat with, someone just to share their worries, their concerns, to offer that emotional support.
Chaplains also spend more time than ever caring for frontline nurses, doctors, and other staff.
I'm observing what I think is a second wave of this virus, and that is a wave of depression, exhaustion, and weariness on the part of the healthcare workers themselves.
Disher offers staff care packages she calls Tea for the Soul on the Go and supports them with short breaks.
We're offering a 10-minute spiritual time that they can call in and have a meditation, have listening to some instrumental music, just a time to take a break, to breathe.
There's also a more delicate battle to assert themselves as essential care. Southern Baptist leader Russell Moore is frustrated that some hospitals see chaplains as just extra.
My concern is we have to see hospital chaplaincy as an essential part of care for patients. And so hospital chaplains have to be able to have access in every way that is safe, safe for the chaplain, safe for the patient. But this is an essential part of ministering and caring for people.
Doug Carver encourages the more than 700 Southern Baptist chaplains he oversees to make their case.
We need to be like the persistent widow in the Bible and to continue to knock on the door of those who are in authority, to remind the doctors, the nurses, the medical staff, the hospital administrators that the ministry of the chaplain, bringing in, if you will, the presence of the Lord through the Holy Spirit, is an essential part of the healing and the help and the life for those patients, that it's about mind, body, and soul.
Carver also thinks the crisis could strengthen the role of chaplains as the brutality of COVID prompts more conversations about suffering, death, and eternity. They're topics that chaplains live out every day. Hospice chaplain Davin Phillips wears a cartoon mask to comfort the children of the families he visits. He'll do whatever it takes to help the dying. For one patient recently, he sang "How Great Thou Art" in full protective gear.
I try to make eye contact, and I have the gloves on too, and try to be able to minister through that. It seems to be helping and making that eye contact and touching, but it's not the same thing. It's obviously not the same.
Heather Sells, CBN News.